Next section we're going to talk about is range of motion. When you get a person that comes to you, a client, you're going to have people that have a certain amount of active range of motion, which means they can take their joint and move it through an active range. But they might be super, super tight, and you might have to help them, assist them with stretching, assist them with trying to get their range of motion where you can, without them doing it, you can move their joint through that. So the active range of motion is unassisted voluntary joint motion. I'm not helping them, they're doing it themselves. And you might have pain that occurs during active ROM, which is range of motion, maybe due to contracting or stretching of contractile tissues such as muscles, tendons, and their attachments to bones. Stretching or pinching non-contractile tissues such as ligaments, joint capsules, bursa, fascia, and skin. Everybody has different active range of motion. We definitely want to get the most out of it, but not everyone is the same, so be aware of that. If you have a person with arthritis, joint replacements, things like that, they're going to keep them from being able to do what we consider a normal range of motion. Everyone's normal is different, so you need to be aware of that. Passive range of motion is the arc of motion attained by assisted joint motion. The client remains relaxed and plays no active role in producing the motion. So this would be a deal where you might be having the person say, let me take your arms, pull them back, I'm going to stretch your pec girdle out, or maybe they're laying on their back and you're trying to do some hip or hamstring stretches on them to help them with their range of motion. Normally passive range of motion is slightly greater than active range of motion because each joint has a small amount of available motion that is not under voluntary control. The additional passive range of motion that is available at the end of the normal active range of motion is due to the stretch of tissues surrounding the joint and reduced bulk of relaxed muscles. So you can usually get a little bit more range of motion passively, partly because you have a tendency to fight the stretching of that, and those tensed up muscles will tend to make it harder for the joint to move. And so if you're trying to get, and that's why stretching is important, that's why we stretch and don't bounce and don't actively contract the muscles. They have to relax to get a full range of motion and stretch. There's another example of passive range of motion that I think we just went over. Okay, then you've got hypomobility, which is a decrease. Hypo means less than. So if you have like a hypothyroidism, you have less than normal amount of thyroid. In this case, you have hypomobility, which is a decrease in a passive range of motion that is substantially less than normal for that joint. So if you have a person with an injury, a lot of times they'll have hypomobility. Abnormalities of the joint surface, which is going to be arthritis, things like that. Passive shortening of joint capsules, ligaments, muscles, fascia, and skin. A lot of times people do not stretch enough, they don't use their joints through a normal range of motion. They get inflammation, which is why you see arthritis is constant inflammation. In return, the fascia will tighten around those muscles and make it even worse. That's why deep tissue massages, things like that, can be very beneficial. And there's kind of what we talked about, osteoarthritis and spinal disorders are common reasons for hypomobility. Hypermobility is an increase in passive range of motion that exceeds normal values for that joint. They have laxicity of soft tissue structures such as ligaments, capsules, and muscles that normally prevent excessive motion in a joint. You'll hear people say they're double jointed, for example, when really it's kind of a layman's term for it. Nobody really has two joints per se. It's just that they have a hypermobility. They may have abnormalities of the joint surface. They might be actually too loose and unstable, and in certain cases that can actually cause problems. They usually have musculoskeletal symptoms from this. They have some abnormalities in collagen. It's thought to be responsible for the joint laxicity in these individuals. So it's definitely, once again, it goes back to what is normal for different people. But a lot of times it's not necessarily a good thing. It can be a bad thing. Joints are the point of contact between bones or cartilage and bones, because at the end of the surface of bones are our little shock absorbers, or our cartilage, which we'll talk about. Joints are classified as immovable, slightly movable, or freely movable. And the amount of movement possible at joint depends upon the way in which the bone fits together, the tightness of the tissue that surrounds a joint, and the position of ligaments, muscles, and tendons. You need to be familiar with your three broad categories. Ligaments, which connect bone to bone, and they help to protect the joint from dislocation. Once you stretch a ligament, it does not go back. That's why you have surgeries. You'll see a lot of ACL, acromioclavicular, joints in the shoulder as well. The ACL is your anterior cruciate ligament in your knee. You'll see a lot of those tears with athletes. And then what I said a second ago with the acromioclavicular joint, or your ACL joint, AC joint, in your shoulder, you'll see dislocations, separations in the shoulder. Once those things happen, it's very difficult to get them back. Cartilage is your shock absorbers I just talked about a second ago. It's a stiff yet flexible connective tissue found in the joints between bones, rib cage, ear, and nose. Cartilage does not contain blood cells. Compared to other connective tissue, cartilage grows and repairs more slowly. Okay? A lot of times you'll see people tearing cartilage. They have their knees lock up, things like that. We call our meniscus in our knee. You'll see that a lot with people having scopes on their knees. Tendons are connective tissue that attach the muscle to the bone. Not all muscles have tendons. Some attach directly to the bone. An example would be the deltoid muscle of the shoulder. Tendinitis is an overuse condition that produces inflammation of a tendon, as opposed to bursitis, which is in relation to the bursa, which is a sac-like structure located between a tendon or a ligament and a bone. The bursa lubricates the site to prevent friction, enables smooth motion of the joints. And so you have any kind of itis you're going to have is an inflammation. But be familiar with ligaments, cartilage, and tendons and what the difference is, and understand that they do not contain blood vessels. Understand that they do not go back if they're stretched. And it's very, very important because they're non-contractile tissues. We talked about that earlier. And so that's very important to understand the differences.